Hi, I'm Gary Chartier from the Center for a Stateless Society. Today we're going to be talking about radical healthcare reform, an anarchist approach. One way to start here is with the Golden Rule. The Golden Rule gives us good reason to value at least three specific goals related to the provision of medical care. We typically value our own physical well-being, so we'd probably like our own bodies taken care of. If we do, we have good reason to want other people to have access to healthcare services. Taking access seriously as a goal means maximizing the number of people with access to decent healthcare. We likely value choice. We don't like other people to run our lives or constrain our options. If we do, we have good reason to want other people not to be pushed around. Taking choice seriously as a goal means minimizing interference with everyone's freedom to make healthcare choices. Now, we also value affordability, right? We don't want to pay a lot personally for healthcare, and we don't want institutions in which we participate to have to do so. So we have good reason not to want other people or institutions to have to pay a lot for healthcare either. Taking affordability seriously as a goal means minimizing the net overall cost of healthcare to at least the economy as a whole, if there's a meaningful way of measuring that. Now, the question participants in current debates about healthcare have to confront is which otherwise just institutional arrangements can enable us to achieve these goals. The degree to which healthcare services are accessible and affordable, and to which people are able to choose healthcare providers and therapies, is determined by structural, political factors. So we have to identify legal norms, political practices it makes sense for us to support and, in appropriate circumstances, enact and implement in light of the Golden Rule. I want to argue here that we can and should work effectively to achieve the goals of access, choice, and affordability by working for the across-the-board elimination of legal privileges that allow privileged elites to reap monopoly profits and limit people's access to care by making and keeping them poor. Getting rid of legal privileges that benefit well-connected elites, getting rid of privileges that limit people's access to care by making and keeping them poor. Now, at first blush, I recognize that it might seem as if achieving all of these goals at once would be difficult or impossible. One option, consistent with maintaining the current model of healthcare delivery, would involve letting people sink or swim in a crisis-ridden economy. Now, in this case, we could achieve affordability while preserving choice, but of course we would be ignoring the implications of the Golden Rule regarding the importance of access. We would just say to some people, go to hell. Now, another option would be to limit choice by rationing. It's not clear that this would ultimately reduce net healthcare expenditures, both because actual rationing decisions would almost certainly lead to cartelization that would benefit privileged elites, and because it would be almost impossible for rationing decisions to be made rationally. In fact, almost impossible is generous. But perhaps it might do so initially. Perhaps rationing might have some initial impact on cost. In this case, we'd have access and perhaps some limited initial degree of affordability, but at what price? We wouldn't have choice. Or we could try to find a way to dramatically expand access to healthcare while keeping something like the current healthcare market. The problem is, we know what doctors charge. We know what hospitals charge. We know what drug manufacturers charge. We know what medical device manufacturers charge. We know what insurers charge to, we're told, make it all possible. And we know the charges are anything but insubstantial. Delivering healthcare services at current prices would be dramatically, overwhelmingly costly. A plan that offered everyone these services at current prices would certainly help us to achieve the goals of access and choice, but affordability would suffer if access were achieved while current price levels were maintained. So what we need instead is to reduce costs by abolishing privileges for politically favored groups. It might appear at first glance as if there were a real problem achieving all three goals. But I believe that's because of an assumption that isn't being made explicit in most of the discussions being conducted online, on TV, and in the print media by Beltway insiders. Almost none of the media discussions, the mass media discussions, address this assumption. That's the assumption that privileged, well-connected political actors can and should keep their privileges. The options getting the most attention in today's healthcare debate are options that largely treat monopolistic and quasi-monopolistic privileges enjoyed by the politically connected as unproblematic. If we want to achieve all three goals for healthcare reform simultaneously, we need to support the abolition of these privileges. Access and affordability are limited by a range of factors. Let's start by thinking about those factors. Drug companies and medical device manufacturers reap monopoly profits because the law gives them patent rights. Those patent rights didn't just emerge out of nowhere, out of the state of nature, out of natural law. They're created by legislation. Patents don't make good economic sense, despite what their corporate apologists might tell you, but they do ratchet up the profits of those who own them at the expense of ordinary people. Now, working hand in hand with healthcare professionals groups, state and national legislatures impose licensing requirements that limit who can provide healthcare services. By constraining the numbers of people who practice various health professions and the kinds of services particular professionals can perform, these requirements boost the incomes of health professionals and artificially inflate the prices of their services. Hospital licensing and accreditation requirements similarly limit the number of hospitals in operation and therefore pad the pockets of existing hospitals while driving up the prices people have to pay for hospital care and other services. Legal limitations on advertising and price competition in the area of healthcare services also make it easy for healthcare professionals to maintain high incomes. Don't underestimate the value to a cartelized profession of limits on price competition and the impact of advertising on price competition. The FDA approval process adds to drug costs and lengthens the times to market of many products in ways that certainly aren't always to the benefit of healthcare consumers. That's an understatement. These kinds of legal privileges are sold to the public, obviously, as if they were designed in various ways to help ordinary people. But they're practical, and in many cases, their intended effect is to take money away from ordinary healthcare consumers and to transfer it to people and organizations with more political privileges. Now, these are hardly the only legal privileges politicians confer on the well-connected that help to keep healthcare costs high. For instance, rules that provide tax incentives for employers to purchase health insurance for employees tend to make it easier for insurance companies to charge higher prices than they likely would be able to charge to individual consumers. Also, state rules that preclude the purchase of insurance across state lines also make it easier for insurance companies to charge high premiums and reap handsome profits without being subject to price competition. Rules that limit who can be an insurer in the first place can have a similar effect. So a physician who wanted to offer patients care on a flat fee per year basis was recently prevented from doing so because this arrangement looked too much like insurance, and the physician, of course, wasn't a licensed insurer. Who benefited? Not the patients, clearly, but the insurance industry. So it's also important to recognize that agricultural subsidies contribute to healthcare costs. By encouraging the purchase of lots of low-nutrition foods, purchasing these items simultaneously redirects resources that could be used to buy foods that made positive contributions to people's health away from the purchase of such foods, and at the same time encourages the purchase of items that may actually decrease health and thus boost healthcare costs. Agricultural subsidies and unexpected contributor, perhaps, to healthcare costs. Here's another dubious legal privilege that also drives up costs. It's the opportunity for plaintiffs in tort cases to obtain